February 4th is World Cancer Day, and we at Fortis thought of celebrating it with the family members of cancer patients and survivors. Cancer is a disease where we have made a lot of progress in terms of the technology which we use, the doctors, and the overall support system. But amongst them, the contribution of family members is immense, and they help in the patients to fight against cancer. You'd be surprised to know that 70% of cancer patients are curable. That is, for out of 100 patients who walk into a clinic, 70 can get cured. Wondering where they are? Well, they are everywhere. The people who have fought against cancer and won against it. And it is their story which you need to hear to believe that cancer is curable, especially if treated early. We at Fortis use all circles to handhold them and to ensure cure.
When you have a difficulty, where do we find the strength? We obviously find it in the family, but do we have a format or a scheme or a support system in place in this country? At this point, no, but going forwards, at least as a part of this initiative, we hope that we're able to look at the family as an essential component of the treatment to return the patient not just with quantity of life, but with quality of life.
That one night when the MRI said that there is something likely to be cancer, and that one night, both me and my wife are alone, our children are abroad. We both didn't sleep too well that night. The moment you think you have cancer, or the moment you hear the word cancer, it's as if somebody is dishing you out the best support. That if you ask me, saying that what is it, that is absolutely something that I would look back and remember for a lifetime. This the best support that we had in terms of the doctors, the medical team, and the people in the hospital. I mean, including the guy who gave me food during the hospital stay. Up to that person, all of them smiling and cheerful, made a huge difference to what I was.
Cancer hits you as a shock. You're not looking merely at a disease, you're looking at the certainty of death. You're also looking to probably the suffering that will go along with that. So when you get cancer, your world is topsy-turvy, absolutely topsy-turvy. I was diagnosed with kidney cancer in 2010, and I'm fine now. At that point of time, I was told I probably had 6 months to 2 years to live. That is without treatment, and if treated, probably 2 to 5 years would be my lifespan. It's now 10 years down the line, I'm still here. I am off all medication. I have to thank my doctor, basically, who pulled me through that morass, Dr. Mattoo, who I think has held my hand along with my wife and family and brought me out of it. I'm very grateful to them to be here today.
Well, on this journey with my husband, I have two words to use: faith and hope, both which are very strong and meaningful. Faith which keeps you going forward for everybody, family members, caregiver, and the patient himself. Hope which also takes you forward, prepares you for the outcome.
Thanks so much for coming over today. Today is World Cancer Day, and the logo between in the past 2 years by UICC has been I can and I will. So you take your own responsibility to treat yourself, to find out what issues you have, to get the best solutions out of it. We totally know that oncology is a dreaded disease. According to the data published recently, almost 1 in 10 individuals in our country, that is 10% of the whole population, is likely to suffer from cancer. That's where the important role of social support groups, where you have people who have gone through this, can guide you, put the family and the individual in the right direction. What exact questions should be asked with the healthcare provider, what kind of solutions you can get, and where all to reach the solutions. So that is the entire concept of having a support group. At Fortis, we are reaching a state in which we totally realize that it's important not just to provide healthcare, but also to provide social support in the form of counseling, in the form of yoga, in form of people who can actually tag on with you to make things easier for you during the entire course. The first type of support group which we want to start here is peer-led support group, in which a patient who has undergone a similar problem comes up and helps. But it has to be led by counselors and psychologists and social workers. So we will try to make sure that these people assist during the whole process. So they can discuss whether there are new trials which they can avail. There are new concepts which they can utilize for their own treatment to make the treatment more successful.